importance of evidence-based policymaking cannot be overstated in the best of times, and it becomes of even greater significance during a global crisis. The Asian Development Bank, in collaboration with the United Nations Development Programme, facilitated such policymaking in the Kyrgyz Republic by jointly preparing a real-time assessment of the potential effects of the COVID-19 pandemic on the country's population. On 18th March 2020, ADB received an urgent request from the Kyrgyz Republic's Ministry of Economy for such an impact assessment. This date coincided with the first official COVID cases being reported in the country. So why was this real-time assessment imperative? It was critical due to the country's growth trajectory being highly susceptible to external shocks and the elevated levels of vulnerability of the country's population to fall into poverty during such times of economic distress. So there was unprecedented uncertainty on the likely scale of the macroeconomic and socioeconomic disruption. The Kyrgyz Republic is a small landlocked country in Central Asia with a population of about 6.5 million. It has been subject to sharp growth fluctuations due to its narrow economic base, which is dominated by exports of gold primarily sourced from a single gold mine. Given few linkages between mining and the rest of the economy, there are few jobs available in the country's formal sectors. Consequently, migrant laborers go to the Russian Federation and Kazakhstan for work, which is why remittances inflows have grown over the last decade, and they average amongst the highest rates in the world today. The country's poverty rate was just over 20% in 2019, with a further high proportion of vulnerable population. So the situation was already fragile pre-COVID. Following the government's request on 18th March 2020, ADB decided by the end of the month to jointly prepare the real-time assessment with UNDP. On 10th April, we presented the conceptual framework to the Ministry of Economy, and on 13th August 2020, less than 5 months since receiving the initial request, we published the final report. So what we prepared was a package with the main assessment report and 5 policy notes on health systems, labor markets, migration and remittances, social protection and food security, and sustainable future. So the question now is, how did we carry out this process? We followed a 4-step approach. Step 1. Identified the external and internal pandemic impact channels. For the external pandemic impact channels, we assessed effects of border closures on seasonal migration of labor. Next, we computed the effects of the prices of 3 commodities, gold, food prices, and oil, that are crucial to the country's exports and imports balance. For the internal pandemic impact channels, we looked at the direct health effects on the population, including when the COVID infection rates peaked in mid-July. Next, we analyzed the effects of the government's enforcement of the state of emergency, which was declared on 24th of March for Bishkek, Osh, and Jalalabad towns and surrounding areas, covering about 40% of the country's total population. Step 2. Estimate the scale of macroeconomic disruption. We estimated this in terms of losses to public sector revenues, export revenues, fall in tourism receipts, and changes to remittances inflows. We analyzed the supply shocks due to the border closures and strict lockdown measures, and demand shocks due to the fall in labor income in households and changes to remittances inflows. We tracked the effects of trade disruptions on the country's fiscal situation and covered the issues related to controlling prices of goods and services in the country, balancing this with the need for providing cheap access to credit for enterprises. Step 3. Assess the likely scope of adverse socioeconomic effects on the population. Headline findings on the socioeconomic effects, starting with poverty, was that we estimated that its rate could go up to about a third of the total population. 4 factors for the likely spike in poverty levels were lost labor income, lower remittances, higher consumer and food prices, and higher out-of-pocket expenses for health-related issues. We computed effects on labor markets on how unemployment could double from 2018 levels. Based on the scale of the sector shocks and distribution of sectoral activities in each region, we projected Osh city and Batken region in the south and Bishkek city and Chui region in the north to be worst affected. On food security, we focused on access issues being at risk due to falling incomes and rising prices, especially for the urban poor. Regarding the adequacy of the existing social protection system, our findings pointed to their insufficiency, and this was due to the limited size of the benefits and eligibility criteria that did not allow for temporary coverage of new vulnerable groups created due to the pandemic. Step 4. Proposed policy recommendations. We made 13 actionable recommendations that continue to be highly relevant today, grouped under 3 areas. These areas are to improve the socioeconomic resilience of vulnerable groups, strengthen economic repositioning of enterprises and micro, small, and medium enterprises, and develop pathways for a green and inclusive recovery. So, were we successful in our efforts? While the socioeconomic effects are still unfolding in the country, including from the political changes in October 2020, our underlying suppositions on the scale of the macroeconomic disruption have been validated, and our projections are also closely aligned with the official data that was released recently by the government. But beyond this, and this being also identified as a significant knowledge solution of 2020 by ADB, we anticipate that the evidence base that we systematically built continues to inform the crisis response measures of the government and ensure equitable allocation of COVID-19 response funds that the government continues to mobilize from different sources of financing, including development partners, starting with ADB.